Can you get gum disease around dental implants? Hi, it's Dr. Adrian from Advanced Dental Artistry, and this is a very common question that patients ask, especially if they're losing their teeth because of gum disease and they're considering getting a new set of teeth with dental implants. The biology around dental implants and teeth is very different. So in short, the answer is yes and no. It's no because when we look at the biology, a tooth is actually not fused to the bone, and there's a periodontal ligament, sometimes called the PDL, or a space between the bone and the tooth. And this space makes teeth slightly vulnerable. It's a great system to absorb shock, and it's a great system to allow us to move teeth with braces. However, because there's this ligament space between the tooth and the bone, we can see that this space can be accumulated by bacteria, and this is what gum disease is. Usually we have plaque that sits above the gum, and this is something that we can brush and floss off. But if the plaque is left there for a period of time, we know that it causes gum inflammation, or what people call gingivitis. As the gums get inflamed, they get puffy, and with puffy gums that are no longer sealing against the tooth, bacteria will start to form under the gums. And when bacteria get under the gums, we know that bacteria forms acid as a byproduct, and this acid will actually start to erode the bone around the tooth. And as the bone drops, we end up with a condition called pocketing. And pocketing is the height of the gum and the depth of the bones. As the bone drops, of course, the pockets get deeper. And if they start getting more than 2 or 3 millimeters, what happens is there's a lot of space for bacteria to live. The role of the dentist or the hygienist therapist or the periodontist is to remove this bacteria from deep within these pockets to get the gums healthy so they seal around the teeth. Well, you all understand that if the pockets are very deep, our toothbrush will not get down into this area nor floss. So if bacteria develops back into these pockets, we will have active pockets again, which basically means that we are still losing bone and we are still seeing a loss of teeth over a period of time. So the question then, why is implants different? Well, implants are fused. So the titanium is actually placed into the jawbone, and the bone actually grows or fuses to the implant. So there's no ligament space. There's no gap between the bone and the implant. However, when I said yes, there is a risk of gum disease, this is usually more long-term, and this is what we call peri-implantitis. Peri-implantitis is again caused by bacteria. It's when a patient doesn't do good maintenance at home by oral hygiene and just cleaning well, and bacteria builds up around the abutment head of the implant. We will then see that the gums will swell or get inflamed again, and bacteria can work its way around the abutment and then to the implant head. And this can happen after 5, 10, 15 years of having an implant placed. What is most important for patients to remember is with full replacement, there are usually only 4 implants, so it's much easier to clean around 4 implants than it is around 16 teeth. However, they must remember that lifelong oral hygiene at home with brushing, flossing and using the water pick is vitally important, and 6-monthly maintenance is critical for the longevity of these teeth. When patients are considering a new set of teeth with dental implants, this is not something where treatment is done and it's just left. It's just good because you've got a new set of teeth. Because of the commensal bacteria in the mouth, which is always present, we always have bacteria in the mouth, we will find that bacteria will build up not only around teeth but around dental implants too. So oral hygiene is critical for the long-term success of the treatment. Please, if you have any questions, you can leave them below. I look forward to one day seeing you in the practice. If there are any questions, I will try and answer them through a new video. Okay, thanks for watching.